Hello, everyone. So in this particular lecture, we're going to talk about counseling microskills, which is Chapter 6 in Erford's Orientation to the Counseling Professions text. So what are microskills? Essentially, these skills are the basic foundations involved in effectively helping clients or in developing strong relationships. They are the foundational tools on which the success of our interventions occur. They help to create the necessary conditions for positive change to take place. They provide the client with such alliance-building constructs as empathic understanding and modeling of genuineness and acceptance, and will greatly facilitate the development of a safe therapeutic environment. Essentially, they will aid in establishing a strong rapport with your client, which is a relationship that is helpful and beneficial to our clients. So, rapport can be understood as a harmonious or empathic relationship. Think about someone that you just like being around, that you feel heard, that you feel makes you better or feel better when you leave them, rather than the opposite. The development of this rapport starts with our very first contact and continues throughout the counseling process. When you greet people, do you look at them? Do you kind of ignore them so they don't ask you questions? Effective rapport is crucial for individuals seeking counseling, as this may be the first encounter with a professional counselor, and this interaction may either encourage or discourage the client from seeking counseling in the future, or for that matter, following up with you for subsequent counseling sessions. What kind of feeling are you giving to the people when you interact with them for the first time? Are they a bother? Do you have too much going on? Can you simply stop and look and say, hello, I'm glad to see you? The essential counseling skills are the micro skills that we're going to cover in this session. Facilitate the process of counseling and alliance formation regardless of the professional counseling's theoretical orientation. So what is this saying? Let me say it clearer. Regardless of what theoretical orientation you come from or you find your base in, humanistics, psychodynamic, cognitive behavioral, and emergent theory, regardless, these micro skills are essential to relationship building and the facilitation of change in people that we work with. These skills are presented as a hierarchy that is organized within a systematic framework. So we have kind of like which ones are our base support kind of micro skills and which ones are extremely beneficial in moving change. All of them are important. At the bottom of the hierarchy, we're going to talk about first our basic attending skills, such as patterns of eye movement and of eye contact, your body language and tone of voice. These aren't the only, but a bit further up on the hierarchy are skills that are surrounding listening and conveying understanding. So this includes questioning, paraphrasing, summarizing, and reflective feelings, which can be difficult for counselors to learn because it's not too often that we use these in our daily lives. So attending skills involves good communication that is more than just verbal content. A lot of what takes place is nonverbal. Are you someone who has a fairly expressive face? Do you smile a lot, maybe even when you're nervous? So you have to be aware of you. Following validation in education, clients ranked nonverbal gestures and presentation and body language as the most important alliance building factor. So, think about this. Validation is being heard, and an education is what they're learning. That's huge, right? Right beside that is the nonverbal gestures, the way that we sit in the developing of our relationship. That's huge. Nonverbal attending behaviors communicate a counselor's interest, warmth, and understanding to the client, and include such behaviors as eye contact, body position, and tone of voice. Let's talk about eye contact. Eye contact is how a professional counselor conveys interest, confidence, and involvement in the client's story. For those clients who have difficulty with closeness, making eye contact can actually be an important vehicle of change. They may not want you to touch them, but when you're paying attention and looking at them, it's extremely important. There should be natural breaks in eye contact. It should be normal and have more of an ebb and flow feeling as you collect your thoughts and listen to your client's story. I have sat back in my chair, take my eyes and look upwards as I think. But be careful. Make sure you be normal and don't freak them out because you don't blink. That is also an issue. You can look away. It may mean simply that you're trying to gather the information, but make sure it's at the right time and that when it's important, you take your eyes back to the person. It's essential to be sensitive to differences in how eye contact is expressed as well. You'll sometimes have people that when you're speaking to them, they will giggle and look down, or for some people even, I don't even know how that happened, y'all. For some people that would even turn away from you when you look at them. That doesn't mean that they're being rude, and it doesn't mean that they're being disrespectful or that they don't want to talk to you. Some of it's culture and some of it's the things that they bring. I have found people who come to me who are shameful. They feel unworthy. They fear rejection. They often don't look at you. And so we have to remember that it's not always about us. The body position. Be sure that you're paying attention to how you sit. If you're thinking of people, how do they convey interest? How do you know when they're really listening? You face the client and adopt an open, relaxed, and attentive body posture. What does that mean? You face them. You don't have to sit straight up in your chair. Leaning forward a little is important, especially if you can get some space between y'all. Be relaxed. Be attentive. And this will assist in putting your client at ease. It'll give them permission to sit the same way. Don't cross your arms and legs. That's hard for some people. It's this natural thing to do. But when you cross your legs, there's one leg that'll extend out often. When you cross your arms, they are considered non-verbally as being closed off. Now, your clients may do that. You need not to. It's not hard for me not to cross my legs because I can't reach the floor. Usually, pay attention to your body posture. Don't sit behind a desk or another barrier like a coffee table. It puts space between you, and if the whole point is the relationship, you definitely don't want something physical keeping that from happening. Lean slightly forward. Let your clients decide the physical distance between you and them by offering to let them arrange the chairs as they feel comfortable. If you will view, there's only a couple of us or maybe 3 of us on campus. If you go to our office, the way we have our desks are such that they do not create a barrier. They're open. If you come to my office, you'll actually see that there are distances between the seating as well as the types of seating, the heights of seating, etc. But I also have a real good boundary of where my space is and where the client may actually roam. Your vocal tone. Pay attention to the tone of your voice. Emotions are frequently conveyed via tone of voice. The pitch, pacing, and volume can all have an effect on how a client responds emotionally to a professional counselor. and your voice can do much to help regulate a soothing and anxiety-regulating atmosphere for the client, so learn to use your voice as a therapeutic tool. The verbal underlining is giving increased vocal emphasis to certain words or short phrases can help convey a sense of empathic understanding. For example, this voice that I use is my teaching voice. And I developed it by teaching 200 freshman and sophomore girls in a gym at one time, teaching them dance routines to do on the football fields. What I have over time developed was this voice that I use in the back of my throat to teach. I often use it to talk to friends, to talk on the phone as well, and usually my friends are pretty quick to go, Avalos, bring it down. When I am in counseling, and I recognize that this voice can even be much for people who are shy, depending on the structure of our classroom while I'm teaching. It's like, Avalos, there's not 200 people here. So what do I do to prepare? There's a difference. The voice that I use right now is one that comes from the back of the throat, that is used to yell and project and over a large number of people and a huge space. If I focus and use my tone that comes from my stomach, probably like normal people do, it will come in such a way that it can't be loud because of where it's originating from. And I don't have to practice to keep it there as much as I used to, where I would literally have to, when I first started counseling, stop myself because my clients were sometimes closing their eyes because it was too loud, and bringing it back down to my stomach. The other thing about vocal tone is, how do you use your vocal kind of ranges to convey meaning, where you could actually bring that sound up at the end that can invoke the idea that we're asking a question. We're checking in, we're wanting to be sure. We'll talk more about that with paraphrasing and summarizing. The basic listening sequence includes this. And please know, this is not always easy for everybody and that you need practice because, like I've said before in the past, this is not something that we use on a daily basis. Most of the time when we're talking to someone, we're thinking about what they're saying, but we're also trying to figure out what we're going to say as well. And so remember that these conversations are fairly one-sided in that it's not about you sharing anything. The only thing that you're sharing is your interpretation of what the client is sharing. So this basic listening sequence represents a set of interrelated skills used to achieve 3 goals. Okay, the first goal is what? To obtain an overall summary of what the client's issue is. What are they saying? What's the problem? The second is to identify the key factors of the client's situation. So they've told us what's wrong. Now, where is this happening? What is the context around it? And a lot of that you'll find is the reason that brought them here to your office. And 3, to identify the core emotions and feelings with what the client is experiencing. So not only do you want to know what's wrong, you want to know why or how that's happening. Try not to use why. And then to identify the core emotions that are going along with that. The skills involved in basic listening sequence are used. You use these methods to figure out 1, 2, and 3. You use open and closed questions, paraphrasing, reflections of feeling, and reflecting meaning. Also, summarizing of the client's information. Let's talk about each of these. Open and closed questions. Some teachers will really know how to do this, especially when they're trying with the age group that they're working with, but as well as trying to get the information that they know. Like, do you get this? Yes or no? Yes. That would be closed questioning. So questioning is a primary skill that allows professional counselors to gather the information they need about their clients. You have to have what you need to make to create some sort of understanding of what's happening. Questions allow us to make an accurate assessment of the client's issues and guide and focus our client so we can make the most effective use of the counseling session. but used inappropriately, questionings can impede communication and block client disclosure. If someone is being drilled with questions, the yes or no, they will get out of their feelings, they'll go to their head, and then we're not getting what we need to be effective. So open-ended questions. Open-ended questions usually elicit fuller and more meaningful responses by encouraging the client to talk at greater length. This could be something as, it sort of seems like a lot. And then we'll hear yes, because blah, 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 blah. Open questions typically begin with a what, how, could, would, or why. Meaning, an example would be, would this be something that happens at home too? Could this be something that is influencing your self-worth? How do you think that might relate to what you explained about your aunt? Those sorts of things. Be careful when using why questions, because whys automatically push the answer up to the brain. Like why? They have to think rather than be present in their feelings of what's happening here and now. They could also cause the client to become defensive, because whys are usually used as a judgment word. Be careful when you're leading questions where you often contain a hidden agenda because the answer or expectation is already embedded within the question. I have found that especially with younger people, they will end up saying yes or something to the questions when I'm leading them because I am the person in the office and I'm the one who has the power in the room. And of course, I'm a counselor, so I must have all the answers right, when that's not exactly what they're feeling. So try not to base emotions or any kind of value or judgment in your question. And sometimes it's easy simply to stay away from things that say, well, why? Our closed questions can be used when professional counselors need to obtain very specific, concrete information and get all the facts straight. Closed questions typically elicit either a yes or a no type of responses or provide specific details or factual information. But be aware that the use of too many counseling or closed questions can cause the client to shut down and become passive because, in essence, you're training the client to simply sit back and wait for the next question to answer. In other words, they're going to make you do the work. As soon as you take it away from them, they'll let you. They don't even have to think besides to say yes or no. And we want them to have the power to move in the directions they want. But also, you must be careful of the content of the question that you're asking. For an example, I had a student when they started working with a client who was telling them about these feelings of lack of self-worth that so many people in their life, and this person's life was pretty much getting this feedback from the world that they weren't worthy, they weren't worthwhile, they couldn't make decisions by themselves, and this is not an uncommon feeling. So my student was really good at connecting with clients and asking questions, but she took it a little bit too far to be more of a conversation than a one-sided, we're here for you, not for me sort of thing. So the perfect example I have is she was meeting with this client, and the client is kind of giving the story, saying what's wrong, and so it happens with me at work too. My boss and my student says, "Oh, where do you work?" What I came back to talk to my student about was like, let's look at you asking, because we video, let's look at you asking this question and then the response to it. The client was in flow, talking about what the issue was, giving examples. As soon as my student said, "Oh, where do you work?" the client sat up and looked at her. I know there was judgment going on as far as like, oh my gosh, if I tell my counselor where I work, will she know him? Will she tell him? And also, afterwards, the client had a difficult time getting back into flow with what they were saying. So much as that they told her, this is where I worked. And when it got quiet, the client asked my student, so what were we saying? You must be cognizantly aware all the time of the questions that you're asking. Are they therapeutically appropriate? Did it matter where this person worked? No, not at all. What happened were the things that were happening, so don't ask questions about the rest. Reflecting skills. The reflecting skills are extremely important, y'all. They represent a set of intervention used to help stimulate clients' exploration of their own thoughts and feelings related to the presenting problem. Did you hear what that said? It's a therapeutic intervention used to help clients stimulate clients' exploration of their thoughts and feelings. So reflecting feelings isn't something as simple as saying, I understood what you said, or nodding your head. It is something that can relay the accuracy to a client that I hear you and I understand what you're saying. These skills will also stimulate a deeper exploration and understanding of the problem so that the client can examine the issues more objectively. So I have had particular times where or my students have as well, watching them, where a client will come with all of these what seem to be separate situations that they'd like to talk about. And then after hearing them, I could say something like, I know you were talking about your boss doing A and B. Almost seems like your oldest son and your husband are doing the same. Providing a summary and often insight that the client may not have even realized before. But in the end, you're really, it's illustrating your ability to listen to everything that they're saying and to try to make meaning. So reflecting skills include paraphrasing, reflecting, feeling, and summarizing. We'll talk about these three now. So to paraphrase, it's how we feed back to the client the essence of what they've just said. Not an interpretation of, not a value judgment of. It's merely reflecting what they've said in our own words, that you're illustrating the content and thoughts of what they've just said. If you look at it like this, the counselor is a mirror, and what it does is mirror back to the client in a non-judgmental way an accurate understanding of the client's communication and the implied meaning of that communication. It is important that the paraphrased information is accurate. You can do this by paraphrasing because it gives you an opportunity to check in with the client. This checking in also allows for the building of a collaborative relationship with your clients and conveys your interest. What it says is, let me make sure I understand. I hear you're talking about this and this, and that it's really making you feel this way. Would it be this, this, and this? And you hear what they say. And sometimes they will be, yes, you heard me. Now, I may have provided a little bit too much judgment or analysis in that last one. Let me think let me try and paraphrase back to you. Another example, this client has just told me about their boss and the husband and the oldest kid, and they're all treated by... It almost sounds like all the people in your life aren't paying attention to everything that you do for them. And that's it. That's exactly what they just said. Reflecting feelings. By reflecting feelings, counselors can help the client become aware of emotions, provide the development of accurate empathy, and help to create a safe environment for clients. We must put the client's state of feelings into work. We use them therapeutically. To do this, be aware of the client's affect. What does their face look like? Pay attention to their behavior. Use a broad range of words to correctly identify emotions. Sometimes young ones don't even have the word to identify what that is. So let's give it a name for them. Silently name the client's feelings to yourself as you hear them. They're talking to you and they're telling you the story. In your mind, you think of the terms as frustration, they're pissed off, they're angry. And you don't have to say that completely out loud at that particular moment. But when reflecting the client's feelings, Use an appropriate introductory phrase. It sounds like you might be. It seems that you're feeling. Add a feeling word or emotional label to the stem. Add a content or context in a brief phrase saying, it sounds like you feel this way. In what context? When your husband behaves that way, or when your wife tells you to do those things. Pay attention to the tense of it. It may be something that happened in the past and maybe not now. If you change the tense to present about something they may feel defensive about, especially when it's a relationship with other people, they turn it around and want to defend their spouse, their partner, etc. So try really, really hard to pay attention to the test as in past tense. If they're still doing this, they'll let you know. Do not repeat the client's exact words because then you sound like a parrot and it gets weird. Reflect mixed emotions when appropriate, and check out the accuracy of the reflection. Sometimes you don't even have to ask, was that right? You can simply use the tone in your voice to say, it sounds like you're feeling really angry because is no one paying attention to you? And you have the question. Reflecting meaning was when you try to capture the essence of how a client makes meaning about his or her life, and how this information can be used to identify the focal point for the client. Help the clients go deeper into their stories and to begin to see how the meaning they construct are significant in shaping their views about themselves, others, and the world. Reflecting meaning can be a difficult skill to master because this is not something that we use in everyday life. And often counselors have to rely on the best intuition or hunch. And we're nervous about doing that because of the fact that if we're wrong, what does that mean to us as counselors? When you actually learn when even you're wrong, it still opens an opportunity for them to explain more. Suggestions to help develop reflection of meaning skills include know some key words to help discern meaning. Use the formula. You feel frustrated because no one seems to realize how much you do. Differentiate between a reflection of feeling and a reflection of meaning. Use open questions to elicit more meaning if you don't get it. So you can easily be able to talk to them about you're frustrated. Why? Because you have the context of people treating you like it doesn't matter. And so then you're able and you're exhausted by all of it. And then you can move forward. Summarizing is extremely useful for the professional counselor. And with summarizing, you can begin to put together the key themes, feelings, and issues the client has presented. The counselor can begin to help the client make sense of an overwhelming and confusing experience. Brief summaries are also useful to help refocus a client who kind of goes off somewhere and can provide structure to the session. And a summary may be appropriate when your client is rambling or confused, when your client presents a number of unrelated ideas, to provide direction to the interview, to help move from one phase of the interview to the next, and to end the interview or provide an opening to the new session. A summary might be, once you have the information that you need, clients will begin by telling their stories. Once you have enough information, you can stop them. You don't have to let them talk for 5 weeks or 5 hours in sessions explaining more. Simply say, so if I'm looking at all of this and what you're saying, it seems like this, and this are something that has occurred in a variety of places. So I can understand why you feel that one of your big goals is this. So let's talk a little bit about what it might look like to get there. So I sort of stopped the conversation of all the stories and then led us to a different part of the session to say, all right, let's think about this a little bit differently. I also like summarizing at the beginning and at the end of a session. I don't know if it's because they taught us how to do this in teaching, but as public school teachers or what, but the nice thing is that you can come in, you can end a session sort of saying, all right, so with our session coming close, let's talk a little. You mentioned A and B. And we talked about some particular areas where you feel like you're strong in C and D sort of examples. So something you can consider between now and our next meeting is this, and we'll talk about that when we get here next week. And then you're done. You can also come back at the beginning of a session and say, well, at the end of last week's session or our last session, we talked about these things, you working on that, and that we'd kind of talk about where we'd get here right at the first of this session. So how about we talk a little bit about that? And I think a nice place would be next is to explore this, providing a direction of what's happening. Now, of course, if they go off in a different area that needs therapeutic attention, then stay there. But it helps when you have summarizing to sort of bring them back on track if they go somewhere else to say, so earlier we were talking this and then we got over here. Let's go back to this. I heard that you were saying all of these things. Tell me more about that. Versus, I don't know why you're talking about that. It doesn't make any sense to this. Kind of summarize so that they remember what it was, that why they're here, attend to that content, and then we can move forward. It's not used in a punitive way. Additional purposes that I've already spoken about. The focus, different types of summaries. The focusing summaries are often used at the beginning of a session to pull together everything that you've talked about up to that point and provides a focus to talk about in the session. Signal summaries are used to signal the client to come back to the essence of their topic that was captured and that the session can move on to the next area. For example, I just said where once you have all the information saying, okay, so I see why that you feel like this is something you want to focus on since you have the information that you need. Is there anything that you can share to give us some more for that? And a lot of clients will say, yeah, I just want to tell you this one more thing. Excellent. And sometimes they'll say, nope, that's about right. It's like that everywhere. And then, of course, planning summaries help to provide closure and are used to recap the progress, plans, and any recommendations or agreement made within the session. Once you have the ability to do these things, you can use them therapeutically. And this is not done, remember, to make a person think something that they aren't, or make someone feel something that they aren't, or for you to even control the meaning of what's being said. Your whole idea is this is part of the microskills that are used to create a therapeutic relationship or alliance to help the client be understood and to make sure that they get that they are aware and outwardly feel confident that you're not only hearing them, you understand where they were coming from and where it is that they hope to go.